welcome back to my channel. I know it's been a while. I hope everyone's good. I hope you're dealing with the lockdown 2.0. Feels quite weird to be sat back in front of a camera because it literally has been, I can't even remember the last time I actually sat down and filmed, because I've done a lot of more like vlogs and things like that. But I'm sitting down again. I've got really awful nails. This is the first time I've done my makeup since we went into lockdown. I'm wearing comfy clothes, but today I am back with a video that I've been saying I want to do for a very long time. As if any of you follow me on social media, I'll link my Instagram here somewhere. I talk quite freely about a chronic medical condition that I suffer with. So I have something called endometriosis, and today I'm going to be filming a video about that. I'm going to be talking about my experience, my journey, where I'm at now, and I'm just hoping that by doing this I can, one, raise awareness of the condition because not many people know about it, and also kind of let people know they're not alone, that other people may be able to relate to my story and ask me any questions, because I'm literally an open book. I'll answer any questions. My DMs are always open, just send me any messages, I don't mind. So that's what the video is going to be about today. I guess the first thing to start with really should be, what is endometriosis? When you get your period, people always say the lining thickens. They always talk about how it's the lining that thickens, it's the lining that sheds when you get your period. This, obviously I'm not a doctor, by the way, disclaimer, I'm not a doctor, some of my facts may be incorrect. If anyone wants to correct me in the comments, I'm fine with that. So endometriosis is when that lining, so that lining is called your endometrium, and when endometriosis is when that lining grows in other places. So most often it's on the ovaries, so you'll get that lining on the surface of your ovaries. People can get it all in your abdomen, you can get it in your pelvis, so you can get it on your fallopian tubes, you can get it on your bladder, your bowel, all in that. And endometriosis has different stages, so it has like stage 1, 2, 3, 4, I think it's 1 to 4, and it all depends on the type of endometriosis you have. So the early stages will be something called like superficial endometriosis, so where it's just on the lining or just on the surface of your other organs, whereas you can get deep infiltrating, I think it's called, where it actually goes deep inside. So this will be things more like bladder and bowel, when the endometriosis is actually found inside. So I guess that's kind of what it is. Obviously you can imagine it causes bleeding and things, because that's the lining that you'd get in your period. So if that's in your other organs, it's still gonna bleed and things like that. What I'll do, and what this video will mainly be about, is my journey and my experience with my endometriosis. So I have actually written things out because I don't want to miss out anything, and my journey actually started 8 years ago. So as you can imagine, there's so much that's happened. I rang up my doctors, asked them if I could have access to like a few of my health records to try and piece together what's happened and be as accurate as I can. I won't lie, there's lots of things I forgot because, as I said, it's been 8 years now. But hopefully this video, I'm going to try, I don't want it to be too long because I want people to actually be able to watch it all rather than feeling like they've got to skip it all. But obviously I want to include everything, so that's why I've written it down. I'm going to try and be as punctual whilst trying to include everything. But if there's anything else that I've missed and you want to ask me, as I said, just message me, comment down below, anything like that. So let's get into my endometriosis journey. It all started in 2012. So as I said, this is all to do with like periods and hormones, so you can't really get it until you've started your period. So I started my period in 2011 when I was 11. I started when I was in school, year 7. I remember I started in the school toilets. I freaked out, obviously, went to the school nurse, was like, oh my god. So I was 11. For the next year or so, I had, I don't even know if it was a year, I think it was like 6 months to a year. I had painful periods, they were very heavy, and as I didn't start young, I started at like a normal age, but they weren't very nice periods. But I just thought I was someone who suffered with bad periods. My sister, she had really bad periods and all things like that, so I thought it just was a genetic thing. Then it was, yeah, if I keep looking down it's because I've got the piece of paper there. It was November, it was like October, November 2012, so I was 12 years old, and I started getting really bad right-sided pelvis pain. Medically this is called like right iliac fossa pain or something. They thought, basically I have a history of like IBS, so irritable bowel syndrome, and so when I went to my GP he thought it was just that my IBS was playing up, gave me some like Movicol, Senecot, painkillers and all of that, and then about a week later I was like, no, I'm in a lot of pain. Obviously I was like 12, I was feeling sick, and it was like a sharp stabbing pain. My sister actually at the same age had something called ovarian cyst, so it's when a liquid filled sac grows in your ovary, and she had to have it surgically removed. I think she was 13, and my sister was like, cause she's 6 years older than me, she was saying, no, she's describing what I had, I think she has an ovarian cyst. Went back to the GP, I think the pain had been going on about a week or two and it just wasn't going away and it was just getting worse, and I got told to go into hospital and have an ultrasound. So I went into hospital, they were like, I bet she's got an appendicitis, which is where your appendix inflames, it's quite common. But my sister was like, she was determined it was an ovarian cyst. She knew the symptoms, she's experienced it. Went into hospital, I remember going in to have an ultrasound. Obviously where I was 12 I was like looking around like, oh my god, everyone must think I'm pregnant. Really, people were looking at a 12-year-old thinking there's no way she's pregnant. Like that's just what I was thinking. Went in for the ultrasound, and because of my age they didn't do an internal ultrasound, they literally just did an abdominal scan. And I remember, because I was watching it because I found it really interesting, I was watching on the screen, and I remember as soon as they went over my right ovary you could just see this big circular mass, and they were like, yeah, they measured it, I think it was 6.5 centimeters, so that's diameter, so that's this way, so say it's like, I don't even know, say that was 6.5 centimeters, it would be all the way around. That's how big it was. I was tiny. When I was younger I was very petite, and so to have something like that, obviously it's bad no matter what size or anything you are, but it was very significant. As soon as they saw that, they were like, okay, yeah, you're gonna have to have surgery. So I literally went home, went back to my I can't remember exactly, I went home, packed my stuff for hospital and had to go into hospital, and I think I had surgery like the next day. It was very quick. I don't really remember much of my first surgery. I was very, 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 very nervous because I've spoken about this in my mental health video. I have a phobia of sick, and obviously if you think of surgery, like a lot of people are sick when they wake up and things like that. So I asked for like the strongest anti-sickness. My mum and my sister got to come down into the anaesthetic room with me because I was just so nervous. As I said, I don't really remember much of it because it was like 8 years ago now. I don't remember going under, obviously. I just remember the anaesthetic room. I don't even remember like waking up or anything like that, or the hospital journey afterwards. But yeah, that was my first experience, and then after that I obviously got referred to a gynecologist because they have to do like a 6-week follow-up when you have surgery. So I got referred to a gynecologist, and I think it was, yeah, I'm trying to think how many I've seen now. I've seen easily about 5 or 6 gynecologists over the 8 years. But I saw my first gynecologist. I remember going back about 6 weeks later, and then, that's a lie, I don't remember going back. But I know that I had continuing pain, like the pain never seemed to ease. So in 2013, because my surgery was November, so obviously my 6-week follow-up and checkups were into the new year. So in 2013 they decided to try me on the contraceptive pill, not for contraceptive reasons, but to try and make my periods lighter and hopefully stop the ovarian cysts. I went on my first pill, I don't remember which one it was, and I actually started having like palpitations, so heart palpitations. Wasn't sure why. Obviously this was very scary. I remember being in and out of hospital, calling ambulances at school. I would be having a heart rate of like 230, 240, like I'm talking high. They kept saying it was anxiety, but then it got to the point where I'd be laying in bed in a hospital ward and the machine, my heart rate would be at like 180, 200, so obviously it wasn't that. They obviously then referred me to a cardiologist, which is a whole nother condition. I have something called inappropriate sinus tachycardia, which I only actually got diagnosed, it's barely even a diagnosis, about 6 months ago. But I basically just get a really fast heart and I'm on medication for that now. But we didn't properly know about it until I got put on the pill. So they thought, let's try you on loads of other different pills. I probably tried about 6-7 different contraceptive pills, which resulted in, as you can imagine, an extensive amount of hospital trips, ambulance calls, all of that. I had all these different monitors for my heart. But this is about my endometriosis, so let's go back to that. But basically I had ongoing pain. I tried all these pills. They were like, okay, you can't have any kind of hormone that goes into your bloodstream because it's just going to affect your heart. So I couldn't have the implant, I couldn't have injections, nothing like that. So in 2014, it was actually Valentine's Day 2014, I actually had the marina coil fitted. So I was only 13 years old at that point, and I had to have, they put me under general anaesthetic because I was obviously so young, and I had the coil fitted. I don't know who knows what it is, but it's basically, it's shaped like an anchor, and I think it just releases hormones into your womb, etc., to stop your periods. Obviously it didn't go as much into my bloodstream as other medications, so that's why I had to have that done. I remember this one quite clearly. So I was obviously really nervous again because it's a surgery. It was a day surgery, but I remember when I had it done at Maidstone Hospital, I remember waking up in agony. So to put the marina coil in, they have to dilate you. So as you may or may not know, you always hear about when ladies are in labour, they're 5 centimetres dilated, 6 centimetres dilated, and that's when your cervix is opening, and they have to do that when they put the coil in. And obviously I'd never even worn a tampon at this point, and I'd been dilated. Obviously I remember just waking up, I was like kicking the nurses. I was in so much pain. I think that's the most amount of pain I've been in waking up from a surgery. I remember just like begging for my mum. So I remember going back onto the ward. They gave me morphine to help with the pain, but the morphine made me feel really sick. And obviously because I have a phobia of sick, I was then panicking. I remember I was like white in the face. And basically when you have surgery, you can't go home. That kind of laparoscopy surgery or kind of any under general anaesthetic, you can't go home until you have you drink water, you go to the toilet and you eat. I remember having to try and go up for a wee, because if you need the wee, sometimes you can't actually feel that you need a wee, but it just feels painful. And I remember having my mum on one arm and the nurse on the other trying to get me to the toilet. I won't even lie, it was awful. I've since had the coil changed and it's nowhere near as bad. I think it was just my age, everything like that. So that's what I had done on the 14th of February. At the beginning of November, I had the coil fitted. I think I bled on the coil for about 6 months. But it did start to kind of help the pain. But I think because it was almost like I was distracted by the other coil. Like, the coil does take a while to settle in, like any contraception. It's adjusting your hormones. Your body has to kind of get used to it. I remember bleeding though for about 6 months straight. I became anemic from the blood loss, so I had low iron. And then actually in November of 2014, I had to have another surgery because I was just in so much pain all the time. The pain, as I said, it kind of eased and then it just came back. So I was still in pain, I was still under a gynecologist, I was still constantly like going into hospital, going into doctors, constantly in pain. And obviously I was only 14 years old. So in November 2014, I had a laparoscopy, which is where they do keyhole surgery. So they use like machines. It means they don't have to completely open you up. And I had something called a diagnostic laparoscopies, which is where they like open you up, well not open you up, where they go in to kind of diagnose to see what's causing your pain. And if I remember rightly, they didn't find anything. They I think they saw that I had a few little cysts, but nothing major. There was nothing, so they couldn't explain my pain. They thought I was just having painful periods from the scar tissue from my previous surgery and things like that. There's a bit of a blank between 2015 and 2017 where I'm not sure what happened. All I know is that I was still getting pain. By looking at my hospital notes and things like that, it looks like I had an ultrasound in July 2015 and a pelvic exam because of pain. In December I had a gynecology appointment. Then in 2016 I went to the doctors again in February for abdominal pain. In December I got referred to another gynecologist. So as you can see, there was a continuing amount of pain going on. Now alongside this pelvic pain, this like periody type pain, I was also having recurrent urine infections. Like I was just constantly getting urine infections. But what would happen is I would go to the doctors with what I thought was a urine infection. On the dipstick, which I don't know if people have had it done, they literally just dip it in your urine. It was coming up that I had like white blood cells, red blood cells, so it came up positive for a urine infection. But once they sent the urine sample off to the lab, it was actually negative for urine infection. So I was constantly getting treated with antibiotics but not actually needing them because I never actually had an infection. So I was actually having bladder problems alongside this pelvic problem. So then in 2017 I'd obviously in December been referred back to another gynecologist, and then in March 2017 I went under general anaesthetic again and had my marina coil changed because they just thought it's been what it would have been 3 years. They were thinking, okay, maybe we should change it, see if that will help anything. So I had that changed again. It was under general anaesthetic because when I had my first coil put in, they had tucked up my strings. So with the marina coil they have strings that hang outside your cervix, and they tucked mine in to just because I'd had it done under general anaesthetic, and I think because I was having problems with discharge, and so they tucked them in just to see if that would help. So then to take it out they would have had to put me back under general anaesthetic, otherwise it would have been really painful. So yeah, that was March 2017, got the coil changed, got a brand new coil. They were like, let's see if this helps. In April I went back to the gynae. This was probably for a checkup, and in June I went back on the contraceptive pill because where I'd been, I am now, since I think about 2015, 2016, I've been taking medicine to slow my heart down. So they were like, let's try you on the contraceptive pill again whilst you're on this medicine to see if you can deal with it. I was put on Loestrin, and I remember within about 4 or 5 weeks I was having palpitations again, and it was like, okay, that's obviously not going to work. Look, as I said, looking at my health records and everything, in the November and December of 2017 I had another ultrasound and I complained of abdominal pain again. So I was just constantly, as you can see, there is a running theme of me just being in pain and not really knowing why, nothing working. All through this they tried me on multiple different painkillers: metformin, tranexamic acid, codeine. I tried suppositories, which is they go up your bum. All of these different things I've been trying and nothing was dealing with the pain. And then in 2018 I had my first urology appointment. So that is for my bladder, because obviously these two symptoms were going side and side. When one flared up it felt like another, and I was having these constant urine infections and they thought there might be a link. So I went and saw a urologist privately under some private healthcare because I've obviously been suffering from when I was 12 years old up to 17. I just wanted to be a teenager. Obviously it's not a condition. There's people out there, and I'm not trying to make people feel sympathy for me or nothing like that. There's people out there that have it a lot worse than me, but I was fed up. I just wanted answers. So in January I went to my first urology appointment, as I said, privately, and they diagnosed me with something called interstitial cystitis. So that is when your own urine actually causes a reaction in your bladder. So that's why they said I was having these positive dipsticks and then negative results when they sent my urine off to the lab. So I was basically just getting a constant inflammation of my bladder. But to diagnose that, they would have to do something called a cystoscopy, which is where they go into the bladder, take a biopsy of it, and also they wanted to do a hydrodistension, because alongside these recurrent urine infections, I was also having problems holding my wee, like if I urgency, things like that, like incontinence. So basically, TMI, I couldn't hold my wee, I'd wet myself when I was laughing, coughing, anything like that. So in the June, I had, because I was in 2018, I would have been sitting my A levels, so I wanted to wait until they were out of the way. So in the June, I had my cystoscopy and hydrodistension, so another surgery. I got warned that this would be really painful when I woke up, and I have to admit it wasn't that bad. So they took a biopsy of my bladder, so that's when they take a sample of your bladder and send it off to the lab. My urologist, who was amazing, and I still see him sometimes, said that my bladder was red raw, like it was inflamed, it was raw, and he said I definitely have this interstitial cystitis. And they did the hydrodistension, so they basically stretched my bladder. So they filled it with water and stretched my bladder to hopefully mean that I could hold more urine before needing to go to the toilet. Because obviously they then could formally diagnose me with interstitial cystitis, they then suggested I had a bladder installations. So these started in October 2018, and they would put a catheter in, and which is where it goes from your wee hole, which is ureter. They put it in your ureter and it goes directly into your bladder, and they would put chemicals inside my bladder which line the bladder so it stops the urine like damaging the wall of my bladder. So to get this done, I had to go into hospital once a week for 6 weeks. I then ran out of private medical insurance because it's very expensive, and had to go over to getting it done on the NHS. So I had about a 2-month break, which meant that we had to start from scratch again. So I had to start getting them done once every 6 weeks. No, once a week for 6 weeks again, and then you basically go once every 2 weeks, then 3 weeks, then 4 weeks, etc. to kind of like wean yourself off of it. These installations I still have now, and they are, honestly, I can now deal with the interstitial cystitis side of things. I did have further tests and things like that, but I now have the installations once every 6 weeks, 5 to 6 weeks, depending on my symptoms. I know when it's starting to flare up. I now take something called Pre-Leaf, which before having any kind of alcohol, spicy foods or anything like that, and it basically just lines my bladder. They're just little tablets. I think I have them here. Hang on. Here they are. So, ignore my nails. This is Pre-Leaf, and it takes the acid out of food, and so that food and drink and things like that, so when it enters my bladder, it doesn't cause any damage. But I now deal very well with the cystitis. I've learnt to manage it by having the installations. Because of lockdown, I had to start doing the installations myself, and I've now carried on doing them myself because it's easier than going into hospital every 6 weeks. You don't have to stay in hospital or anything, it's literally just like a 15-minute appointment, but it's a lot easier to do it myself. But yeah, that's how I deal with. And then because I had the interstitial cystitis, they were kind of thinking, is there a link between the both? So then in 2019, it's when things started to get actually really bad with my like period side of things, because I think in 2018 I'd kind of got to the point where I was like, let's focus on my bladder, try and get my bladder sorted, see if that will actually help my period side of things. So in March I went to the doctors and gynecologists with pelvic pain again. They said, okay, let's try another type of pill. So I had to try another contraceptive pill, but as I said, we all know what happens with me in contraceptive pills now. It didn't work, so they put me on Femodet, and a couple of weeks later I had to stop it because of my heart. And then in, I think it was, so it would have been like August, September 2019, I had an appointment with my gynecologist, who I absolutely loved. And it turned out the gynecologist I got sent back to, because I basically got sent to a gynecologist that specialises in urology, so bladder, and gynecology, so periods and things. So it was perfect for me because I had both problems. So in September or August time, I had an appointment with him, and he basically said, right, we've tried everything. We tried you on multiple different medications. I think it's time we go in. So I don't think, oh my god, I don't think I've even mentioned the symptoms of my endometriosis. So it got to the point, this whole 2019 thing, I think it was in 2017, 2018, I went to my gynecologist, sorry, we're going backtracking a bit, and I basically said, look, I'm getting severe pain during sex. So whenever I would have sex, it would feel like I had like a stabbing pain in my right hand side. I would bleed during and after sex, and after having sex for the next couple of days, I would be in so much pain. Obviously that's not what you want, and that's when they kind of thought, okay, there's something really not right here. And I had the surgery in September 2019, and that is when I got diagnosed with endometriosis. So that is 7 years, nearly to the month, that it took them to diagnose me with endometriosis, and it's actually average time to get diagnosed is 8 years. So at least I'm a bit quicker. But they found I had endometriosis on my right ovary, and they removed that. I also had it on my ureter, so the tube that takes your bladder, your wee hole. So I had endometriosis there, and I remember waking up from that surgery and my consultant coming in, and he was like, yeah, you've got endometriosis, we're sending it off to the lab, but we're pretty sure, so we need a follow-up. I actually felt a lot of relief that I finally had a diagnosis, because going 7 years without knowing why I'm getting this pain and people thinking it's just bad periods, people doubting you, it's not a very nice experience. So then in the October, November, I went back to my follow-up, I saw the pictures, he was like, okay, so now you've had it removed, hopefully you should be fine for the next couple of years to 5 years. It's unlikely it will come back sooner than that because you've had it removed. Alongside that, he also wanted to do something called I think it's like urinalysis, and he wanted to see if I had any other kind of bladder problems alongside the cystitis. When I actually went to my urinalysis appointment in the December, which was hands down the worst experience I've ever had. So as you can see, it was manageable, it was copable, but as you can see, I've gone through a lot of different surgeries. Like from the age of 12, I've had doctors, male doctors, going up inside me, having a look, having a feel. Like, I'm used to all that. But this urinalysis, I'm probably saying it wrong by the way. So basically, I went into a room, and they put a tube up my nun and up my bum hole. They then filled my bladder up and then made me wee in front of them with the tubes in. It was awful. It was painful. It was awful. They said I kind of have a bit of, my bladder doesn't hold as much as normal, but it was kind of like, okay, nothing's really wrong. And they sent me off to physiotherapy, which I still have for my bladder. But when I went to this appointment, I was like, my pain's come back. My endometriosis, I had about 3 months with no pain, and it was amazing. It was 3 months of no pain. That's the first 3 months of no pain I've had since, it's the first time I've had no pain since I was 12. So it was amazing. But when I went back in December, I was like, look, the pain's starting to come back. I'm starting to get pain during sex again. I don't know what's happening. He went, okay, let's keep an eye on it. I'll see you again in a couple of months and we'll scan you. Then it was about February, end of February 2020, so this year, and I was in agony. I went into A&E, they thought I had an appendicitis. I was like, no, look, I know I've got a cyst, I can feel it, la 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 la. They were like, no, appendicitis. I got taken into the surgical, like, assessment unit, and they scanned me. They refused to do an internal scan, and I was like, that's the only way you're going to see it. Like, I wasn't trying to be like, I know better than you kind of thing, but I was like, why aren't you doing internal? So they did an abdominal scan. They're like, no, we can't see anything, gynecologically you look fine, everything's normal, go home, come back tomorrow. So I came back. Oh no, I think I went home on the first day and then came back and had to have a scan and everything, and then they sent me home and said, go back and see your consultant in a week's time, or like as soon as you can. So that was a Sunday, so I had booked to see my consultant the following Monday, like not the day after, the week after. Saw him on the Monday, he scanned me and he went, did they say they didn't see anything? I was like, no. And he went, you've got an endometrioma. So an endometrioma is like an ovarian cyst, but it's made out of the endometrium, the lining. So it's filled with blood, which can be really dangerous. And he went, and I think it was about 6 centimetres again. This was in my right side again. He also found that my ovary was stuck, so it was immobile. Your ovary is supposed to be floating within your pelvis, but mine was stuck because of the endometriosis adhesions. So I then found out I had to have another surgery. This was literally 6 weeks after my first one. So on March, I think it was March the 2nd, 2020, this was 5 days after me and my ex broke up. So as you can imagine, not in the best state of mind. Went in to have surgery. They found that, yep, it was an endometrioma, and I had a little bit of adhesions on my left side as well, so they removed that. I remember waking up, I actually fainted after this surgery, just because I think it's where I'd had so many general anaesthetics. I think this was like my 6th one. So obviously like my body was getting used to it, but it meant that I kept needing more. So I was in a lot of pain. I remember I think just that surgery and the one in September was the most painful I'd been in recovery, because obviously they'd removed quite a lot of tissue and things like that. I then basically got referred to another gynecologist. He's like the specialist one for endometriosis, because obviously the surgeries weren't working, my pain was just kept coming back. He was like, you need to go and see a specialist. So in about June, I think it was like May, June time, I saw a specialist, but obviously I had to wait for all of the COVID stuff to be over. And I had to have an MRI scan, I had to have tests, I had to have he basically wanted to like start from scratch. And he did like every test, an ultrasound, as I said, MRI scan, everything like that. So the MRI scan came back clear, but majority of the time endometriosis doesn't show up on it unless it's really deep. As I said about the deep infiltrating, unless it's really deep, it doesn't actually show up. But he said that he wanted to try me on a medication called, well, a type of medication that puts you into temporary menopause. So I got put on a medication called Cineral, which is a gonadotropin inhibitor. So it basically stops my hormones, and as I said, puts me into a menopausal state. He said this should obviously preserve what I've got, it should stop any new adhesions going. So I actually got put on that beginning of August this year. But then about 2 weeks into my treatment, I started getting really bad pain again in my right side. So I went into A&E, no one could come with me because of COVID, it was quite scary. Went into A&E, got a scan, and they said that I had an endometrioma on my right ovary and 2 on my left, and that both my ovaries were now stuck rather than just my right. And yeah, they basically said that's why you're in pain. They said they can't operate because obviously of how many surgeries I had in the last year. They didn't want to operate until I'd seen my consultant, and he was actually on annual leave. They said, we're going to dose you up with painkillers. And I will say now, in the last year I've discovered the one painkiller that works for me, and it is naproxen. Everyone's body reacts very differently, so what works for me won't always work for someone else. But I take naproxen, and it is the only painkiller that works. Naproxen in a hot water bottle, that's what sorts me out. But so I started, obviously they said that hopefully the Cineral, it should actually help the endometriomas resolve themselves. I obviously saw my consultant, he said he didn't want to operate because the chances of there being a complication is much higher now. I've had so many surgeries and there's a lot more scar tissue. So he said that he doesn't want to operate and try and deal with the pain. It should resolve itself in the next couple of months. And obviously being told that, it was like, right, so I've got to deal with pain for the next couple of months. But I put on the Cineral. I didn't really have any kind of side effects. Like I've had a few hot flushes, that kind of thing. But I actually, after a few weeks, realised I didn't have any pain anymore. Like I was having sex and I had no pain. Honestly, I couldn't remember. I was like, oh my god, I've had about 2-3 months of no pain. It was only when I looked back and thought, when's the last day I was in bed in pain all day? And I was realising I was having sex and I was fine. The days I was having sex, I was fine. I was still bleeding here and there, but it was okay. And then about a couple of weeks ago now, I suddenly had really bad pain. I was bleeding really heavily, which you're not supposed to bleed when you're on it because obviously it stops your hormones. Bleeding really heavily, in pain, pain with sex again, all of this kind of thing. And so I rang up my consultant about a week ago, and I've actually got to now try injections because he said that I may not be absorbing the nasal spray properly because the Cinderella was a nasal spray, and he said I might not be absorbing it properly, so I've now got to start injections, and I actually have it tomorrow. So I thought this was probably a good place to do this video because then I can do like a 6-month update, because I have to take these injections for 6 months. But obviously it's putting me into menopause, which means I'm going to get hot flushes and all of that fun stuff. So that is where I am now. I know this is probably a super long video and there's so much information there, but I'm hoping that by making this video it can make people like aware. One question that I get asked a lot, and one question I worry about a lot, is my fertility, so whether I can have kids. So the statistics are kind of like 50-50, so 50% chance of being able to have kids naturally and 50% chance of not. But for the 50% chance of not, there's like, you can get IVF and things like that which help. This treatment that I'm on to put me into menopause should actually help my fertility because it should stop me getting any more adhesions, so stop anything getting worse. But I've basically been told that I should be having kids by the time I'm in my mid-20s, just because that's when you're most fertile, and then if I can't have kids, I'm still fertile enough to be for IVF and fertility treatments to be most effective. So hopefully the answer to can I have kids is yes, but I literally won't know until I start trying. So I think that is definitely my biggest worry. I did actually, for people out there who are suffering, I actually started counselling. I did like 6 or 7 sessions to try and learn how to deal with it, like being told you're going to have this for the rest of your life, that it's probably going to affect your fertility, all things like that. It's not very nice, especially in the position I am now where nothing seems to be working. Yeah, it's not very nice, but I think there's a lot, it's been spoken about a lot more now. There's lots more, like it was in the news, on BBC News the other week. It actually happens to about 1 in 10, I think the statistics are. So I don't know, like I know that I'll be able to manage it, it's just, it's hard. And obviously I worry about things like finding a partner that's going to understand, and what if I can't have kids, no one's going to want to, like obviously these thoughts go through my head, but I'm trying to remain positive. I think talking to people is what helps me. That's why I want to put this out there, because if anyone wants to talk about how they're feeling, if they're in the early stages of diagnosis, if you've not been diagnosed yet, and a lot of the time doctors kind of just say, yeah, you've got painful periods, but you know your body, and if it sounds similar to what I'm saying, I think that definitely the pain with sex, that's a big one. I think once I said I was having that, they were like, okay, yeah, like we need to check it out. But yeah, so that is actually my endometriosis journey, and I'm still on it and it's still going strong, but I'm definitely going to probably film an update if there is a big update, but it'll probably be in 6 months when I've had my 6 injections, because they're once a month. I'll probably update you then, give you a review. They're called Zoladex. If anyone's got any tips or like been on Zoladex, please let me know. But I really hope this video helps someone. I really hope that you guys have enjoyed watching this. I know it's not really one of my usual videos, but I just want to put it out there, hope that someone benefits from it. But thank you so much for watching. Don't forget to like and subscribe if you want to see more of my content, if you want to be able to see my 6-month update. As I said, my Instagram was listed earlier, and it'll also be in my bio, and I talk a lot about anything that happens on there, so you can go follow me on that if you'd like to. But as I said, thank you so much for watching this video. Thank you for all you guys' support on all my videos, and yeah, I hope you enjoyed, and I shall see you in my next video.